A Mayo Clinic study has discovered a new indicator that patients may be at risk for heart disease. That study used AI to enhance routine scans for heart disease relating to coronary artery calcium. Researchers followed scans from 12,000 adults from the past 16 years. Dr. Francisco Lopez Jimenez says one of the main discoveries was that having an increased amount of fat tissue around the heart can more than double a patient's risk for heart attack and stroke. Luckily, thanks to this discovery, he says doctors should be able to find more than one risk factor with the same scan, giving patients the ability to detect risk factors early and to be proactive.
If we identify those who are at the highest risk, we can be more cost effective. We can target the therapies better. We can make patients more aware of the risk and actually more motivated to change behavior and to take medications and to turn things around. Because
Dr. Lopez Jimenez says that while weight loss can help reduce some fat around the heart, it isn't the only factor, and studies around what can lead to excess fat buildup, there are still ongoing.